One of the things that I'm very passionate about is managing pain in the body, the face, anywhere with Botox. I manage migraines, TMJ pain. In fact, I had my master injected a couple weeks ago by my nurse in a way that I taught her to do for me, and I feel so much better. I also inject every part from toes, back, feet, fingers, ankles, knees, elbows, etc. And I get very instantaneous relief from pain, which is very weird. The one caveat is that I cannot tell you I'm repairing any damage. So if you got knee pain, I can make you have less pain. It doesn't mean you can go out there and, jog 5 miles. You definitely need to see an orthopedic surgeon or someone to help you make sure that what's going on is managed. All I can do is manage the pain. It's interesting. I've got a few of my staff used to work for neurologists, and they can tell you that, and I've seen this with all my patients, that when you go to a neurologist, you try to treat it for pain, try to treat the pain with Botox, and you get quasi results. You get a little bit of benefit, it doesn't really get alleviated, and you got to go back, and they're using 2 or 3 bottles of Botox, like 300 or 400 units. Whereas I can knock it out with literally half a unit. So they're using 800 times the amount that I'm using, and they still can't get it. Why is that? The analogy I use is that I'm a sniper and they're shooting grape shot. They're like, if there's a target out a mile from here, they're basically putting blindfolds on, shooting all over the place and hoping something hits. And occasionally they'll hit the target. Whereas I'm within a foot of the target with a gun, and I'm aiming at it, and I'm shooting. So, and I get the results, and I get very, very, very quick results, which is really bizarre because Botox doesn't typically work in minutes or seconds. I mean, a second, not even minutes, just a second. It's fixed, and it doesn't come back, at least for a few months. And if it does start coming back, then you just do it again. And over time, I can oftentimes extinguish pain for a very long time. So it's very unusual how I've now been able to refine this to the point where I can get instantaneous pain relief. In animal studies, it says that Botox takes about 12 minutes to improve. And in humans, it can be up 90 minutes or even longer. So it doesn't really make sense because, the conventional understanding is that it blocks the presynaptic junction of the acetylcholine release in the neuromuscular end plate, which is a mouthful, but that's basically how we think about it for working. Well, that can't happen in 1 second. And so another mechanism is occurring that I'm using for Botox for pain, but I get incredibly good, profound relief. In fact, when someone has a migraine, my goal is not just a little bit of improvement, maybe happening a week later. I'm talking about instantaneous gone. Like I had my one staff member gets migraines all the time, and whenever she gets one, I just inject it and it's literally gone. She can't do work, and within 1 second, she's totally normal. So my goal with migraines, with pain, etc., is to actually completely wipe out the pain in 1 second. If I didn't do that, then I have not done what I feel is adequate. And it is really a wonderful, wonderful gift that I have been able to develop this method that I think almost no one else understands and get instantaneous relief for my patients. Now, the one caveat is that besides the fact that I don't know if I'm truly helping an underlying pathology, as I mentioned, the other thing is that, I cannot guarantee that it's gone. But I will tell you that I'm very confident in my skill sets that I've seen instantaneous pain relief for a vast majority of patients that suffer from various ailments.